Hi, I'm Resshaya, and a very good evening from Singapore. I'm very excited to share with you the co-design of a digital behavioral light intervention targeting older adults in Singapore. I'm a part of the Lightspan project, and so I'm ready to share a little bit about what is it that we've done here. I'd like to acknowledge all the organizations and the individuals who support the Lightspan project, especially my team members here in the Lightspan team. So, population aging is accelerating, just to set the scene. And so, to ensure that an extended lifespan is accompanied by a health span, preventive medicine is vital in preserving functional independence. So, by combining preventive care, digital health as an accessible tool, and a focus on vulnerable populations, in our case, aging population, Lightspan brings together these constructs to promote healthy aging through light exposure. So the objective of our study is to optimize light exposure in older adults to improve physiological outcomes through a mobile health or mHealth behavioral change intervention. I'd like to introduce you the Lightspan recipe. So in the pot, we have a mobile health app, which is called the Light Up app, as our digital health promotion driver. And through this app, the participants will receive guided light exposure throughout the day that aligns with their lifestyle and infuse feedback-driven methods to facilitate sustained health light behavior. And hopefully this leads to the promotion of healthy aging. Now, in our intervention, the Light Up app will be paired with an Act Lumos light logger, and participants will be able to visualize their daily light exposure, set goals, receive feedback and motivation, explore education modules, and receive notifications as well. And we will be assessing a multi-domain health outcomes to observe the efficacy of the intervention in real-world community-based delivery setting. But the question is, how do we get to this? And what I mean by this is, where we have an intervention where the recipients or participants of our intervention are happy to be part of the study with positive adherence and sustained engagement. So did you know that lots of money is being wasted in health research that does not lead to meaningful benefits or is of limited relevance for its end users? So of course, part of the research waste is attributed to non-publication, incomplete reporting, and poor design, but there's the fact that the outcomes that are actually being researched are not relevant to the end users. Billions of dollars. And so we need useful clinical research that aligns with the priorities of the end users, have value to the recipients, and are acceptable over time. How do we achieve this? Via co-design. So in co-design, we as healthcare researchers would actively involve end users in developing the product or interventions through knowledge sharing. So I believe that co-design is not optional, it is essential. It's more than just a tool. It's a way of doing research that recognizes participants as partners, as collaborators, and experts in their own life. It transforms lived experiences into evidence, and these experiences might often be overlooked in research. So with co-design, this improves the relevance and feasibility of the interventions that we design, builds trust in the science, and provides the recipients or the end users with ownership. And this would facilitate sustained engagement. Co-design also provides a platform for vulnerable groups to be heard. So building interventions for the community with the community is the primary objective of co-design. So I believe that if we want to truly, focus on inclusive research and provide digital health solutions that work in the real world, co-design is not optional, it's essential. And now that brings me to what we did in the Lightspan project here in Singapore, from community engagement to the pilot study. First, so you have a study in mind, and especially when it's community-based. You can't just walk out there and expect participants to walk your way. So the first thing you need to do is find community partnerships and form collaborations that align with the objective of your study. What we did is we collaborated with active aging centers in Singapore by Lions Befrienders, which is a national funded organization supporting senior citizens in Singapore. And so we formed the collaboration and we signed a memorandum of understanding. It was a long process of kind of getting them on board and making sure that our schedule aligns with theirs. So there's a lot of logistics that goes into actually planning a co-design, but I think we have amazing support from the Lions Befrienders team. And moving on from that, the second step in our co-design process was the conceptualization of the study framework and intervention development. So we had to land on a behavior change theory that would work for the intervention that we had in mind. So after a thorough search of the literature, we landed on the self-determination theory as a behavioral modification theory to apply, taking into consideration the aspirations of older adults to live with preserved well-being, different user types within the aging population, and supporting autonomy for older adults in the hopes that they take ownership for their health. So in the SDT, it posits that facilitating competence, autonomy through empowerment, and relatedness via social support can drive internalization of sustained behavior and lead to improved health outcomes. So from this process, we have also come up with the co-design protocol for the Lightspan project. And as we explored existing light-based interventions for older adults, this led to us coming up with the protocol for a Cochrane overview of reviews, exploring ocular light interventions targeting the health outcomes that we are currently investigating in our study. So what's next? We're finally on site. We started with an educational talk and recruitment. So during the education talk, we gave the participants enough time for them to ask us questions, get to know about the project. We gave them knowledge in layman terms, because I think light exposure was a relatively new concept in terms of how it can improve their health. And the eligibility criteria for our study was, as long as you're an older adult, generally healthy, and the most important is that they had to be able to know how to use a smartphone. We signed them on, and I do believe that the educational talk was an important part of the co-design, because that's where we built rapport with the community and started building a little bit of trust with the participants that we plan to co-design with. So the next was to actually bring in the other stakeholders into the co-design process, which were the community service providers. So we had 6 community service providers from Lions Befrienders. So for context, Lions Befrienders are no stranger to co-design. They have multiple projects and digital health innovations that they have co-designed with older adults. So we thought, who better to get advice and consult from than from them. So we obtained feedback based on the intervention that we had, the study design that we had. We gained insights on what their experience were and what we had to take into consideration when planning the co-design process, and potential barriers and facilitators to administering the intervention among older adults from these active aging centers. So what they shared with us is that the older adults would participate if the study was interesting and motivating. We were told very bluntly to expect non-compliance and high attrition levels, to keep communication simple but supportive. And they also advised us a little bit on what senior-friendly user interface and user experience would be like. And I think what was interesting was that they told us to be aware of the fact that recruitment across different locations would be different based on socioeconomic differences and demographic variability. So the 5th step, prior to engaging in the actual co-design and discussion processes, We collected some baseline information, background information about the participants, and this was done via telephone call interviews. So we got some insight about their current light exposure behavior, their health literacy, smartphone use, their mobile health literacy, physical activity levels, and their current sleep quality. Next, we carried out the focus group discussion. So we had 38 older adults, we had 38 participants, and we conducted 6 focus groups where each group would consist of 4 to 6 older adults. And the setup was that we would go as a team on site. We would have one moderator, one note taker. We had 2 recording devices. And this is how the participants were seated. So it's square table discussion. And the outcomes of the focus group discussion was to gain their user experience and attitudes, feedback on the lightspan intervention, and the wearables that they were going to be wearing as part of the intervention, and also feature preference questionnaire for the development of the UI UX of the app. So this is just a little tidbit or a little summary of what we actually obtained from the focus group discussion. And participants linked light exposure with vitamin D most of the time, but they were not very aware of the fact that there's more to light than just seeing and vitamin D. They were relatively familiar with digital health apps. They use this mobile health app called Healthy 365, which most older adults in Singapore are using. They said that they would be open to be using the app if it was simple. But I think one thing that was very jarring is the fact that they wanted a clear link between light exposure and how it impacts their health. Another jarring feedback that we received was the unacceptability of the aesthetic of the light logger that we had. But most of them were really keen to participate, and their motivation for participating in research was like the research, the interest in the science, the health benefits, and also the incentives. But they did have concerns about the long study duration, wearing multiple devices, and forgetfulness in terms of like complying to the intervention. So next. This was the biggest chunk of the co-design process. So the prototyping workshop, from the feedback that we received from the focus group discussion, we had a prototyping workshop where we had 2 moderators, 1 note taker, voice recorders, and this time we had a Figma UI UX prototype, and we collected feedback via Mentimeter on tablets, and we also had a storyboard slide deck. So in the prototyping workshop, our goal was to evaluate the reactions of the participants to the prototype that we developed, to capture their preferences, test the usability, and also to garner feedback to refine the UI UX. We also wanted to assess their comprehension of the app as a whole and how it works. So I just want to share with you what their responses were in terms of what words come to mind when you think of light and health. And I think my favorite is TV. So prototyping workshop, what did we do? So participants were given time to interact with the Figma prototypes on the tablets, and they loved it because it was so big, because it was on a tablet, and they were hoping, we had to explain to them that this is just a prototype. It's on the tablet, but it's not going to be this big on your phones. We also had to give them a refresher of what the light up objectives were. We gave them a storyboard walkthrough of what the app would look like. We also had a hands-on exercise, and they had to complete tasks on the Figma prototype. And then we finally gained feedback on what they felt about the whole app setup. Yeah, they liked our app. So I just want to show you what the Figma prototype looked like. And finally, this is the app that we came up with. So we're very proud to actually roll out the app for pilot studies for the co-designers. And so the next step, the feedback from the co-design process has informed the consolidation of our main trial protocol, and you can check it out here. So what was the final step in our co-design process? It was the pilot study. And in the pilot study, the co-designers tested the app, and the feedback from the pilot study informed the iteration of the second version of the Light Up app for the main trial. So I just want to share with you some smart principles that we learned from the Lightspan co-design process. So be specific, use clear layman language, define what co-design is and what it's not. This is not a wish list session. Next, make sure that the feedback you obtain is measurable, track participants' responses and engagement, gather quantitative and qualitative assessments. Next, make sure that the intervention you design is achievable. So keep the design feasible and balance feedback for something that is generally acceptable, because we cannot please everybody in the room. Make sure it's relevant, aligns with what they need, and involve community partners, for example, the consultancy that we had with the community service provider. And finally, be very wary of the resources that you have in terms of time, dedicate enough time, and set clear ground rules and session timelines. And I think these are the magic beans that you should have when you plan a co-design study. I hope that everybody co-designs after this. And these are my references, and thank you.